None of the producers have any financial interest in the products or procedures shown. Abnormal iris configuration and position can induce various clinical disorders. One among them is Plateau iris. Plateau iris is termed so as it simulates a plateau land, which is a land significantly raised above the surrounding region. Iris, imparting the unique color for the human eye, is named after the Greek goddess Eris, meaning rainbow. In the embryology of the eye, iris development starts as early as the 4th week of gestation. The iris develops from both layers of the optic cup. The outer layer of optic cup forms the pigmented layer of the iris, and the inner layer of the optic cup forms the non-pigmented layer of the iris. Neural crest cell gives rise to muscle layer of iris. PAX6 is the key gene in the eye development. Iris consists of an anterior limiting layer, stromal layer, anterior epithelial layer, and posterior pigmented epithelial layer. Anterior chamber angle is the anatomical recess formed between the corneosclera and the iris. Abnormal angle recess can lead to angle closure. The angle closure can be a block at iris level, block at ciliary body level, lens or posterior segment. Plateau iris is a type of predisposition for angle closure where the block is at the level of the ciliary body. During development, if the ciliary body is positioned anteriorly, a large or anteriorly positioned ciliary body can maintain the iris root in proximity to the trabecular meshwork, creating a configuration of plateau iris. In this anatomical variation, the root of the iris is short and anteriorly inserted on the surface of the ciliary body. Plateau iris syndrome refers to the condition in which angle closure is still present, confirmed by gonioscopy, despite a patent peripheral iridotomy that has removed a degree of pupillary block and without a shallow anterior chamber. Though there are laser treatments for plateau iris, we present a novel method of single-pass 4-throw pupilloplasty for treatment of plateau iris. Ultrasound biomicroscopy and gonioscopy are the first-line tests for early assessment of plateau iris. With high-frequency, high-resolution ultrasound biomicroscopy, we can image the structures surrounding the ciliary body, posterior chamber, iris-lens relationship, and angle structures. The extent or the height to which the plateau rises determines whether or not the angle will close completely or only partially. In the complete plateau iris syndrome, the angle closes to the upper meshwork or Schwalbe's line, blocking aqueous outflow and leading to a rise in IOP. This situation is far less common than the incomplete syndrome, in which the angle closes only partially, leaving the upper portion of the filtering meshwork open so that the IOP will not rise. The physical presence of the lens behind the iris plane holds the iris in position and tries to prevent posterior movement of the central iris. As a result, a sinuous configuration occurs, termed as sigma sign. The iris follows the curvature of the lens, reaches its deepest point at the lens equator, then rises again over the ciliary processes before dropping peripherally, forming the double hump sign. Thus, much more force is needed during gonioscopy to open the angle than in the pupillary block because the ciliary processes must be displaced. Provocative testing in eyes with plateau iris configuration may help in diagnosis following laser iridotomy. Under normal room illumination, the angle with plateau configuration is narrow but open. During dark room provocation and ultrasound scanning, the peripheral iris dilates and appositional angle closure develops. Treatment options. An ND-YAG laser peripheral iridotomy can be performed in initial cases. An argon laser iridoplasty, where large spots are given for long duration and low power to extreme iris periphery, can also help in a few cases. In surgical methods, iridoplasty or pupilloplasty involves the mechanical pulling of the iris away from the angle and keeps the iris position using non-absorbable sutures and thereby maintains the angle open. In Plateau iris, we have shown satisfactory IOP control and good functional outcome with SFT. Single-pass fourth-row pupilloplasty is a novel method of pupilloplasty where single anterior chamber pass through the cornea followed by four throws are performed to make tight knot in the iris. This pulls the iris away from the angle and changes the vector. The technique provides easy learning curve with minimal tissue manipulation and surgical complications. The surgical knot is strong enough, comparable to a timber hitch knot, providing good stability. In an OCT analysis, we have noted no tissue damage or loss with maintenance of iris architecture. Knot region can show minimal changes with proline suture end far away from the corneal endothelium, thereby preventing endothelial cell loss. Postoperatively, pupil dilation can be performed to an extent to evaluate the fundus for screening. The post-surgical mydriasis has also been studied after SFT. Moreover, SFT can easily be combined with cataract surgery with intraocular lens implantation. Since there are a few treatment options and no treatment is fully successful, single-pass fourth-row pupilloplasty can certainly be useful in such eyes with failed PI. In this patient, the preoperative Plateau iris configuration, which has been corrected by SFT, can be seen by the anterior segment OCT analysis. Similarly, many patients with failed PI have been benefited with single-pass fourth-row pupilloplasty. Preoperative diagnosis of Plateau iris by gonioscopy and UBM is necessary in such cases. Trial of PI can be performed to rule out primary angle closure, simulating Plateau iris. Laser PI can fail in some patients due to peripheral anterior synechiae and scarring. SFT has a benefit of mechanical removal of the synechiae during surgery in such eyes. When PI seems to not provide control of IOP and the gonioscopic features shows Plateau iris, one can proceed with SFT. Thus, with added advantage of easy technique, less instrumentation, less surgical time and good functional outcome, SFT in Plateau iris can be a good alternative.